All right, let's dive right in. Today, we're going to talk about a vitamin that is absolutely essential for our body to even work right. I'm talking about vitamin B12, and specifically its medication form, cyanocobalamin.
You know that feeling, right? When you're just totally wiped out, just dragging yourself through the day, and it's not just one bad night's sleep. It's this lingering weakness. Well, what if it's not just plain old fatigue? What if it's your body trying to tell you something's missing?
So, a major reason for this kind of deficiency can be a condition called pernicious anemia. And what's fascinating here is how it works. It's not usually about you not eating enough B12. The real kicker is your body might be missing something called intrinsic factor. Think of it like a key that unlocks B12 absorption. If you don't have the key, the B12 can't get in. And without it, you can't make healthy red blood cells. It's a huge problem.
But, okay, let's zoom out a bit. Pernicious anemia is a big piece of the puzzle, for sure. But really, we're talking about any kind of B12 deficiency. It could come from all sorts of malabsorption issues or, sometimes it really is just a gap in your diet. The main thing is figuring out why it's happening.
Okay, so we've identified the problem. Now for the good part, the solution. This is where cyanocobalamin comes into the picture. Let's get to know it.
So that's the real question, isn't it? If the body is having trouble absorbing B12 the old-fashioned way, how in the world do we get it back in there where it's needed? Well, turns out there are a few clever ways to do it. We've basically got four main options on the table. First, there's the one we all know, taking it orally, as a pill. Then there's an intranasal spray, which is a little different. And finally, we have what are called parenteral methods. That's just a fancy word for injections. You can do it subcutaneously, right under the skin, or intramuscularly, which goes deeper into the muscle.
And check this out. Each method has its own little instruction manual. If you're taking it orally, you want to take it with food to give it a boost. For the nasal spray, you've got to be careful about hot foods. Timing is everything because heat can mess with how well it's absorbed. And for folks who really struggle with absorption, those injections are often the only way to go.
Now, giving the medication is really just the kickoff. This isn't a one-and-done kind of deal. The next play, which is just as important, is keeping a close eye on everything to make sure it's actually working.
So what does that look like in practice? Well, before you even start, you've got to get a snapshot of where things are, your baseline. That means checking B12 levels, of course, but also hemoglobin, hematocrit, and your red blood cell count. You'll also want to look at something called the reticulocyte count. That tells you if your body is making new red blood cells. Then you just keep checking those numbers every 3 to 6 months to track the progress.
All right, every playbook has a section on risks, and this is no different. Let's talk about the fine print. With any treatment, you have to know what to look out for. It's all about keeping patients safe.
There are three big ones you want to keep on your radar. First is erythema, that's just skin redness. Then there's hypertension, or high blood pressure, and the one we really need to watch closely is hypokalemia, which means your potassium levels have dropped too low.
And that low potassium, or hypokalemia, is super important. If you even suspect it, you've got to check those potassium levels right away. The telltale signs you're looking for are things like muscle weakness or any kind of irregular heartbeat, which can get really serious really fast.
So that brings up a good question. Is this treatment the same for everybody? Nope, not at all. For some people, you have to be way more careful. Let's break down who falls into that category. I like to think of this as red lights versus yellow lights. The contraindications, those are hard stops, red lights. If a patient is sensitive to cobalamins or has a specific nerve condition, it's a definite no-go. But the precautions, those are your yellow lights. If someone has heart disease, for example, you can proceed, but you do it slowly and with a whole lot of extra monitoring.
Next up in our playbook is interactions. You can never look at a medication in a bubble, right? You always have to ask, what else is going on? What else is the patient taking, eating, or drinking that could throw a wrench in the works?
And this stuff is so important. Take folic acid. It can actually hide the signs of a B12 deficiency, which is tricky because you might think things are getting better when they're not. Alcohol can mess with how well the oral form is absorbed. And get this, even something as simple as vitamin C can affect the oral meds, so you have to be smart about timing when you take them. Every interaction has a consequence.
You know, for a lot of people, especially if they have a condition like pernicious anemia, this isn't a temporary fix. We've got to think about the long game here. We're talking about lifelong care, and that means we need to empower patients to be a real partner in their own health.
This quote really just hits the nail on the head. If your body has a fundamental, irreversible problem with absorbing B12, then the treatment has to be for life, and being upfront about that from the very beginning is absolutely key.
So how do we actually empower them? We give them simple, clear instructions. A checklist of things they need to call about immediately. Things like muscle weakness, remember that potassium issue? Or that pins and needles feeling, which is called paresthesia.
And hey, let's not forget, we can look beyond the pharmacy. For people who can absorb B12 from their food, the kitchen can be a pretty powerful tool in all of this.
And some of the best places to find it are in dairy, cereals that have been enriched with it, egg yolks, and certain kinds of seafood. Getting more of these into your diet can be a great way to support your overall B12 levels.
When you really step back and look at the whole picture, the medicine, the monitoring, the diet, the patient knowing what to report, you see what this is really all about. It's a partnership, a team effort. That's the only way it works long term.
And that kind of leaves us with one final, big question to chew on. We've got the science, we've got the playbook, but the real art, the real challenge, is figuring out how we translate all this information into action. How do we help turn these instructions into habits that stick and create real, genuine empowerment for patients? That's something worth thinking about. Thanks for joining me.